Hello, everyone, and welcome to this audio podcast. And this audio podcast is part of the Pathology edition, and this audio podcast is part of the an audio podcast as part of the Type 4 squad, and also an audio podcast as part of the Ty4Phoon Twixzter. This audio podcast will provide a base, provide new view in around the critical analyses and we'll have and also looking at the implications of practice or for practice and this audio podcast or this audio podcast series has been in around looking at an overview of a peer review works from 2020, looking at healthcare scientists looking at healthcare scientists in primary care, and where this peer review works was well, from 2020 was a systematic review, a sort of research article published in the American Journal of Biomedical Science and Research, um, and um, and so in around the critical analyses, in around the critical analyses. So patients or service users seek understanding of laboratory tests or investigations and information through, for example, online support groups, web portals, smartphone apps, often this can be non-evidence based. Health literacy is and can be a barrier, and studies inform online portals are not currently or have not been designed to present test results to service users or patients in a meaningful way. Little is known about patients' understanding of results received through electronic patient records. Having access may not guarantee that service users or patients know how to utilize the context. Patients and service users still want sort of more face-to-face understanding of test results and investigations, or at least have professionals be part of online discussions where they can provide where they can get where they can get where they can get care in through through professionals. And whilst providing service users and patients may sorry whilst providing service users and patients with access to laboratory test results through electronic patient records is advantageous. It is insufficient by itself to meet patient requirements or service user requirements, and interpretations also differ. To facilitate service user service to facilitate service user or patient sort of sort of in around and around between between sectors, healthcare sectors. This sort of the step in around the step in around for example, electronic patient records, or EPRs could could be accompanied by strategies to support and interpret and investigation manage investigations manage investigations. Digital sort of digital scientists in a way might be another progressive proposition where healthcare scientists could be involved through online consultations with service users and patients, providing basic science of tests for basic science of tests for service users or patients to prompt shared decision making. And there is now more scope where healthcare scientists can professionally be integrated into primary care to support best practice, bringing service for patients with bringing service for patients with CK um, diseases sort of closer. Uh, yeah, bringing service for service users or patients with diseases closer. And so in around sort of the in around the implications around practice. Um, uh, so this sort of basic could open doors for to involving scientists more so on the front line supporting care more so for patients or service users will with long-standing conditions, with an increasingly sort of growing older population and service users and patients with sort of multiple diseases, the need for healthcare scientists in primary care to support practice on frontline, providing services relating to disease trends could become important owing to patients or service users with long-standing conditions being propagated to self-care, and this would also sort of alleviate the sort of technical and even technical or the scientific burden of primary care physicians, and at present there have been investigations regarding to regarding to regarding regarding sort of regarding sort of different stages of different disease or different diseases between laboratories and primary care. And whilst there have been extremely whilst there have been whilst this has been encouraging, prompting collaborative working is needed and required to better the care for service users and patients in and between healthcare sectors. So that draws a close to this audio podcast as part of the pathology edition, where this audio podcast was looking at the a sort of analyses or sort of a critical analysis and looking at sort of implications of practice. The audio podcast that will follow will look at some we'll look at providing or look at providing some conclusions and a summary. So that draws this audio podcast to a close. This has been an audio podcast as part of the pathology edition, an audio podcast as part of the Type 4 squad, an audio podcast as part of the Ty4Phoon Twixzter. It's been an audio podcast as part of another Storm Robotics production.